Fellow healthcare providers. My name is Dallas Bradley. I'm a student nurse at Methodist University, and I'm here today to talk to you about Ebola preparedness training specifically for healthcare facilities and safe management of patients with EBD. So, according to the CDC, which is the Center for Disease Control and Prevention, healthcare providers caring for Ebola patients are at the highest risk of getting sick because they may come in contact with infected blood or body fluids. In preparation for the possible spread of this epidemic stateside, this presentation is purposed to educate healthcare providers with the most up-to-date information concerning safe management of a patient who is diagnosed or suspected with the Ebola virus disease. Alright, so just a tidbit of recent history. To date, the 2014 Ebola breakout is actually the largest in history. This graph is from last month, October 30th, 2014, with a source of CDC and the World Health Organization. And you can see here that in 2014 there have been just as many cases in this year alone as there has been since 1976. And one of two people infected during this outbreak actually end up passing away. So how is Ebola spread? According to the CDC, Ebola enters through patient direct contact. So body fluids of a person who's sick or has died from Ebola, objects contaminated with the virus, and bats infected with Ebola are thought to be the origin. And Ebola is not spread through air, water, or by food. So, Ebola can only be spread to others after symptoms begin. Symptoms can appear from 2 to 21 days after exposure, and as long as 21 days passes, if an exposed person does not develop symptoms, they will not become sick with Ebola. Alright, some Ebola signs and symptoms. The early signs and symptoms are very nonspecific, so it's actually very tricky to diagnose Ebola because such nonspecific symptoms as fever or lack of appetite, muscular aches, joint aches, that could be something like malaria. So it's very, very difficult to diagnose early on. Some other symptoms that come along the way are red eyes, headache, hiccups, sore throat, difficulty breathing, swallowing, abdominal pain, and vomiting. And later on is GI problems such as episodes of watery diarrhea and rash and bleeding. So, there are two indicators to start thinking or considering Ebola with a patient. And the first one is going to be the patient is presenting with the previously mentioned signs and symptoms or has a history of exposure to a person with Ebola. It can be that and or the patient has a travel history to Liberia, Sierra Leone, Guinea, or Mali. So diagnosis. The Ebola virus is detected in blood only after the onset of symptoms. So it can be as much as 3 days after the onset of symptoms before detectable levels of the virus are reached. Initial laboratory tests used in diagnosis include the antigen capture, enzyme-linked immunosorbent assay testing, polymerase chain reaction, and virus isolation. So, the Ebola clinical course. This is a compilation from 1976 to present. So the first symptoms actually start showing up around day 7 to 9. With this particular outbreak in 2014, it's more around day 9. Day 7 to 9, you start feeling, as an Ebola patient, headaches, fatigue, fever, muscle stiffness. And day 10, sudden high fever, vomiting, blood, and passive behavior. And that moves on to day 11, which is bruising, brain damage, bleeding from the mouth, and eyes, nose, anus. And then day 12 is loss of consciousness, seizures, massive internal bleeding, and death. Alrighty, so treatment. There's currently no vaccine that's FDA approved for treatment of Ebola. The symptoms of Ebola and complications are treated as they appear. Basic interventions, when used early enough, can significantly increase the patient's chance of survival. Such things as providing intravenous fluids and balancing electrolytes, maintaining oxygen status and blood pressure, and treating other infections if they occur. Safe patient management and care. All right, so the first thing you do if you suspect a patient might have Ebola is you are going to immediately isolate the patient in a separate room with a private bathroom. Upon patient admission, you're going to want to obtain detailed information about the patient's symptoms, contacts, and travel history. Be sure to collect data on the earliest date of symptom onset, the sequence of signs and symptoms development before presenting to the ED, detailed and precise travel history, so dates, time, locations, and names of any persons the patient may have had contact with during or after the earliest date of symptom onset. Alrighty, so initial and continued care would be attend to the patient's medical needs as they appear. Consider and evaluate the patient for all other potential alternative diagnoses. So malaria, typhoid fever, the flu. And this is because, as I mentioned earlier, symptoms are very nonspecific. So just because you have a fever does not necessarily mean you have Ebola. So after you've isolated the patient, you're going to want to activate the hospital preparedness plan for Ebola that all facilities have in place by now. This includes immediately initiating the notification plan for a suspect or confirmed Ebola patient, ensuring hospital infection control is notified, and creating a clinical care team led by a senior level experienced clinician, but also should be composed of no less than a hospital infection control specialist, a senior nurse, an infectious disease specialist, and critical care consultants. Assigning a senior staff member to make sure that all laboratory tests are reported and results from the hospital laboratory, state health department laboratory, CDC, and local and state public health are done efficiently so that, to break down any further contact with the Ebola virus. So, personal protective equipment. Some of the key principles are, prior to working with Ebola patients, all healthcare workers involved in the care of Ebola patients must receive repeated training and demonstrate competency in performing all Ebola-related infection control practices and procedures. I have provided a link to the PPA guideline, which is called a standardized protocol on how and where to use, remove, and dispose of PPE, and it's been provided in the handouts for review, and courses will be required at a later date from selected personnel. So just a quick rundown of PPE for Ebola. From head to toe, it is recommended by the CDC and the World Health Organization that powered air purifying respirator and hood is used, surgical hair cover, nitrile gloves, which 2 pairs. If the second pair, if the first pair doesn't cover the cuff, the second pair should. Impervious coverall, which covers scrubs and undergown, impervious gown, and the impervious leg and shoe covers. No skin should be showing or have air contact with when giving treatment to an Ebola patient. So, patient care considerations. Dedicated medical equipment, preferably disposable, should be used for the provision of patient care and cleaned and disinfected according to hospital policies. Limit the use of needles and other sharps as much as possible, and all needles and sharps should be handled with extreme care and disposed in the designated puncture-proof sealed containers. Limiting phlebotomy procedures and laboratory testing is very important as well, since the Ebola virus is transmitted via direct contact with bodily fluids. All right, so the CDC says that aerosol generating procedures should be avoided for patients with Ebola. Visitors should not be present during AGPs, and healthcare providers should be kept at a minimum. If an AGP is absolutely necessary, conduct environmental surface cleaning following the procedure. Monitoring and management of potential exposed personnel. So, for healthcare providers specifically, a log of all healthcare personnel attending to an Ebola patient must be kept. Personnel suspected of exposure to Ebola through body fluids should immediately stop, wash their hands or the infected skin surfaces with soap and water, and contact the occupational health providers or supervisor in order to assess and manage exposure to pathogens as soon as possible. Visitors should avoid entry into the patient's room unless deemed essential to the patient's well-being. This is often taken case by case and decided by the physician. A record of all visitations must be kept in a log, and visits should be scheduled and limited to the patient's room and an immediate adjacent waiting room if necessary. Prior to visitation, all visitors should be provided instruction on hand hygiene, limited surfaces touching, and proper use of PPE while in the patient's room. So I have provided handouts. One handout at the very front is going to be the Ebola Key Fact Sheet. There's another handout that will be distributed to each unit in the hospital. It's a checklist for preparedness of the Ebola virus. And then also the third handout it's basically signs and symptoms of the Ebola virus and how to see the difference between Ebola and, say, the flu. Does anyone have any questions? Thank you so much, guys, for listening. If you have any questions, feel free to email me or come up here afterwards and we can chat about whatever you would like. Thank you.